Okay, so you should all see a recording in the upper left-hand corner. So for those who don't know me, I'm Joanne Kelleher. I'm the director of the Early Childhood Collaborative of Southington. And our guest this week, we've been meeting every other week with the childcare providers in town, is Julie Condit. She is the ECCP consultant who covers the Southington area at Wheeler Clinic. So, Julie, I think I've taken you off of mute.
Okay.
Okay, I think that's worse.
Oh boy.
You're getting some feedback.
Is your computer off? Is the volume on your computer off? Is she on mute?
So, Julie, you need, because I'm going to be sharing the slides, why don't you disconnect from your Zoom video? And hopefully that will help with the feedback. And once I see you've done that, I will take your phone off mute.
Can you hear me at all?
Well, now I'm hearing you come through the Zoom application on your laptop, and you're connected via the phone, so you have to pick one or the other. So it looks like she's.
How about now? How am I coming in right now?
That's pretty good. Yeah.
That's pretty good? Okay. So maybe what I'll do is, Joanne, if you want to share the slides, I'm going to keep my video off and just keep it like this, and hopefully that works.
Okay.
And I'll just tell you when you can go through the slides.
Yep.
Or when you can switch to the next slide. So thank you all for being patient. While Joanne gets this set up, I'll just introduce myself. My name is Julie Condit.
Julie, we heard your name and then you dropped out.
Mental health consultation program. Am I coming out again?
Now you're back in.
I'm back in, okay. We're a statewide early childhood mental health consultation program, and we work with caregivers of young children, mainly teachers and parents, around ways to support children's mental health, their social emotional development. We often work on things like how to manage challenging behaviors or help children deal with big feelings, helping children get along with others. Typically we go into the classrooms and the homes, to do this work, but obviously because of the pandemic, we're not doing that right now. And we're working remotely. So really what I've been doing is just providing consultees, support by phone, going to a lot of community collaboratives. And I was telling Joanne that something that I'd be interested in doing is just talking to caregivers right now a little bit about ways to support children, families, and staff's mental health upon return to school. Because like Joanne, you were saying yesterday, the early care and education centers are starting to open, reopen. And things are starting to, return to some sort of normalcy, at least with children's schooling. And, although I think a lot of families and children are excited, I think there are also children, families, and staff as well that are pretty nervous about this process. So I thought we'd talk a little bit more about it today. Joanne, if you want to go to the third slide.
Can you see that?
It's still on the first one. The third slide where it says a lot has happened since March.
That's what I'm looking at.
Oh, okay, for some reason. Can everyone else see that slide?
Colleen,
As
what do
long
you
as you
see?
guys could-
I'm not seeing the third slide. There we go.
There we
There
go.
it is.
Yay. So it's really important to think about how much has occurred in the last few months. This will definitely impact how children and families feel about children returning to those early care and education centers. You know, when children and families start back up, they may have a lot of questions. Children may wonder, why are there health screenings? Why am I new to the classroom? Where are my old teachers and friends? Families may wonder, will my child be safe? Will my child be happy? What will happen? So it's really important to think about, you know, some of the thoughts and fears that, you know, children and families have when returning to their centers. You can go to the next slide, Joanne.
There seems to be a lag between when I move to the next slide and when you see it. So maybe next time, let me know ahead of time.
Okay. So as she gets that set up, you know, we really want to think about building relationships with children and families, whether this is their first school experience or whether they're returning back after all this time off. And we know that by forming warm and welcoming relationships with children and families, we can hopefully help alleviate some of those fears and uncertainties that they may have developed as a result of this pandemic. You can go to the next one, Joanne. And it's okay, I know there's going to be a lag. Some of the things that you'll see on the next slide are about things to consider when building relationships with children. There are so many factors, you know, that are a part of a child's disposition, their behavior. We want to think about their temperament. So are they easygoing, or are they rigid? Are they active or less active? We want to think about prior experiences that they may have had in the classroom, their likes and dislikes, their ways of coping and being comforted, their culture. When you talk about culture, you know, we're not just talking about traditions within a child's ethnic, but we want to think about some of the traditions within their family or within their community. You can go ahead to the next slide, Joanne. And of course, if we've had these children before, we may already know the answers to some of those questions. But we really can't know any child without building relationships with the families. So especially right now, since we all have been at a distance from each other, we want to consider various forms of communication. So email, text, photo communication. I know some places have done some virtual meet and greets with children and families that are newly enrolled. And obviously you have to check on center policies regarding sending messages and video messages. But if, you know, the center policy allows it and you have time to do it, you know, maybe teachers send a brief video of their classroom, what it looks like, a brief video of themselves, introducing themselves to children. So things aren't completely unfamiliar when children and families come to the center for the first time. I know some places have talked about creating an online questionnaire to send to caregivers with some basic questions to get to know or re-know their children. And you can use programs like Google Docs or SurveyMonkey. You can go to the next slide, Joanne. And when you're building relationships with family and you're asking questions, you're asking caregivers questions prior to children. Yes, you may ask those basic questions like, what are your child's likes and dislikes? What is your child's temperament? But these might be some new questions that you think about since we've been through this pandemic. You know, concern about your day. How make you feel more comfortable? Have you noticed during quarantine? Has your child progressed or regressed in any skills during quarantine? Even though we've only really been out since March, for young children, development happens so quickly. So you may have a student who, was still in diapers, and now they come back 3 months later and they're in underwear. So don't take for granted some of the changes that may have happened within these past few months, and that can be really valuable information for you to have when welcoming them back to your classroom. And of course, when creating a questionnaire for new or returning children, you want to think about asking questions that would give you information that is really valuable to you, that maybe you wish you had known about past children that you had in your classroom. But at the same time, understand that families may not be ready or comfortable at that time to answer those questions. And that relationship building does take time. Go ahead, Joanne. So like we talked about before, there's children and families are going to come with a mixed bag of emotions. Children feel worried, scared. Families may feel the same. And it's really okay and encouraged to empathize with those feelings, while also assuring children and families you'll do your best to make school a safe place for them. I think we need to find that balance between validation and reassurance, because families are taking a big step to leave children in your care. And you want families to know that you're going to keep their children safe. So as children come back to school, whether they're a new student or a returning student, they're likely going to have, just like we talked about in the first slide, they're likely going to have a lot of questions, especially if the classroom, the people in it, the routine are a lot different than what they've encountered in the past. Teachers will be wearing masks, that will be new to them. So it's okay to answer those questions or ask children if they have questions. When children know what to expect, that'll help them feel safe and secure. And when children feel safe and secure, they have better control over their behavior. Sometimes, as caregivers, we may wonder how much information should we give children? Definitely want to answer their questions, but keep answers simple and age appropriate. So they have enough information, but not too much. Scripted and social stories are great too. The next slide has an example of that. But I put a little link below. You don't have to click on it now, Joanne, but we could definitely put it in the chat, or you're welcome to look at it later. But this is a resource that I've referenced a lot. It's from 0 to 3, and it lists some common questions that children may have developed during the pandemic, like why do we have to wear masks, or why do we always have to wash our hands? And 0 to 3 provides some really nice responses to those questions. So I definitely encourage you to check that out. You can go to the next slide, Joanne. And I know there's a lag, but the next slide just shows a little example of a scripted social story that may be helpful to children in preparing them for what their classroom may be like, what their routines may be like, what they'll be expected to do. This is from Teachers Pay Teachers, and I think probably most of you know what a social or scripted story is, but they're basically short stories that help children learn more about a specific social situation. If you want to get really creative, you can make your own on Microsoft Word or PowerPoint. but there's tons out there that you can get for free. And this is actually a free one on Teachers Pay Teachers. And I have one on my computer as well that I can send to you, Joanne, to give out to people after this training. Oh, and if you do want to make your own social story, on our website, ECCPCT.com, under activities, we have a little section on how to make a social story, if you want to get creative and make your own. So of course, an important part of welcoming new children is getting them acquainted to rules and routines. You know, I can't stress enough that when children are cared for with consistency and predictability, they're more likely to feel safe and secure and have better control over their behavior. A lot of what I'm going to be talking about in terms of rules and routines is, you know, basic positive guidance, and I would encourage it whether we were in this pandemic or not. But I think it's going to be especially important now, just because children are going to need a lot of guidance and encouragement to acclimate to these new rules and routines. So remember to keep rules and simple, clear, and descriptive. Consider creating visuals of the rules and routines and posting in a few visible areas of the room. Definitely review the rules and routines for a few minutes each day. I think sometimes we think that we can talk about it once and, you know, children magically remember them all and can implement them perfectly. But we know that young children have short attention spans. So in order to really store something within their long-term memory, we have to review it in small doses consistently every day. You can use puppets or dolls to model new rules, such as good hygiene or safe ways to greet or comfort someone who's upset. And definitely keep your expectations realistic. The maximum number of rules to 5 or 6. And I would say that's for preschool. You definitely don't want to have a laundry list of rules. That's going to be frustrating. But visuals. So the one on the right, how to wash your hands, I think you can get that free from the Sesame Street website. I have that saved on my computer too, so if anyone wants it, I can send it over after this. The next slide I just got today, and it shows different ways to greet people without necessarily touching them. The only one that I'm not a huge fan of is blow a kiss, but the other ones I think are pretty good. And again, we know children are very visual, so I think the more visual, the better. So like I said before, you know, we can't just, you know, create these nice visuals or these nice lists of rules and routines and expect that, you know, children are going to master them right away. We have to consistently review them and support children in following them. So one thing that I can't emphasize enough, and I think is going to be really important, especially if we're trying to not rely on physical touch, is finding different ways to gain attention. Right? Sometimes I think we go quick to, and I'm guilty of it too, we go quick to trying to redirect a child or tell a child something without getting their attention first. We have to get the attention first and give the message. So some more indirect ways of getting children's attention without relying so much on that physical touch, maybe using some sort of auditory cue, like ringing a bell or playing music to signal a transition, saying a child's name in a sing-song voice or a whisper voice. So modulating your voice to get their attention, or using gestures. So not just, but telling them while showing them what to do. And using lots of positive reinforcement. Again, rather than punishment in terms of promoting behavioral change. And I think especially right now, when all these changes have happened, children are going to need a lot of encouragement to acclimate to the new rules and routines. Definitely, because your face will be covered with a mask, try to play up your body language. And I really think if you smile, it'll show in other visible areas of your face. You know, your eyes will widen, you'll probably do something with your hands. You know, definitely more than usual, really try to show a child that you're happy with what they did, because you can't rely so much on your face now, or at least your smile, you can't rely so much on. As we know, young children come with big feelings. You'll definitely have your kiddos that, well, some may come with some big excitement and some may come with some big worries. So try to reassure children you'll do your best to keep them safe and healthy. And again, like I talked about before, don't be afraid to answer their questions. Just make sure your answers are brief and age appropriate. Keep a consistent routine and tell children what comes next. Really try to keep those daily rituals. Again, I think this is not just for children, but for humans in general. Rituals help us feel settled. So I always, right when I wake up, I need my morning coffee. That's my ritual. So some rituals that you could pass are missing the same morning song, or reading for a book every time before nap time, or at least having a few days rotating periodically. Help feelings and tell them it's okay to feel that way. Avoid avoidance. When we're talking to children about their feelings, we're not giving them the opportunity to work through feelings. So try to think about labeling feelings as a learning opportunity. And after helping children label their feelings, teach them safe ways to deal with those big feelings. And these coping methods may look a little bit different than before, just because we want to minimize contamination. And I was talking a little bit about this in another community collaborative yesterday, where some of us may have our little cozy corners, areas where children can go to deal with big feelings or when they need a break. We just may not be able to include some of the same items that we included before, like those soft plush items. We may have to include more washable items, things that are plastic, like a plastic or a chair, or even a cardboard box. I'm sure, I could find several from Amazon, several large cardboard boxes in my place right now. And you can make those disposable. Maybe creating a little bin, using a plastic bin and creating a little comfort basket. So children have access to different manipulatives to help them calm down. And again, whether we're in this pandemic or not, children are still children, and they still need comfort, and they still need soothing, and they still need hugs. So I understand that some people, of course, some people are going to feel a little less comfortable with having that physical contact. But hopefully if you practice the precautions that the OEC has put in place, you can still give those hugs without being that you're going to get sick, because children do need those. So this is it's just some visuals for helping children deal with feeling scared. So this, I don't know if you guys are familiar with Consciousness One. Some of you may be familiar with the program, but Becky Bailey, who founded it, came up with different cute visuals to represent breathing strategies. So if you actually go on her website, and I put her website in the in the resource slide, you can look up, what the star looks like, what the drain looks like. I think the star is putting both hands in the air and then taking a deep breath. The balloon is putting having children put their hands on top of their head and blow themselves up like a balloon and let the air out. But she's got some really cute little visuals. And if you did think about now creating a classroom comfort box, because of COVID and trying to minimize exposure, you may not create, one giant classroom box, because then you have multiple children touching the things within it. But if you do have the resources and you don't have that many children, I know some teachers have been actually making little individualized comfort boxes for each child. So only the child is touching their comfort box. You go ahead to the next slide. So something that is likely going to come up with children returning is children experiencing separation anxiety. A lot of them have been, home, not even really going outside of their home, but really have been staying in their home with just their family members. Some of them haven't even seen or had any contact with their friends or their relatives. So to then have to leave the home and adjust to being around other people, that's understandably going to be hard, very hard for some children. So these are just some strategies to think about to help children with that separation anxiety. Like I talked about before, if your center allows it, maybe provide a virtual preview of the classroom and activities to children that are newly enrolled, so they can feel a little bit more comfortable before stepping into that environment. And gently encouraging a brief goodbye ritual between children and families. So not trying to pull the child away from the parent, but just making that goodbye a little bit more structured, because we know what happens when it's less structured. It tends to go on for longer, and then it's harder for the child and the family to separate from one another. Setting gentle and realistic limits around staying at school. Try to avoid promises of leaving early. I know it's heartbreaking when a child says, I really miss mommy, can I go home early? And you just want to say, well, let's see how it goes. Maybe we can do it later. But then the child holds on to that. And if you do fulfill that promise, that doesn't help you develop a relationship with the child because the child's leaving early. Or if you don't fulfill that promise, then that might prevent the child from really developing a trusting relationship with you. So again, this is about validating the child's feelings, but setting limits that the child is at school right now, and that they'll be able to go home later. And really try to talk about some of the fun things that you're going to do at school. I would say, and this is just my personal opinion, if there's a pattern of a child, let's say over the course of a few weeks or even a week, having a lot of trouble separating from the parent, rather than expecting the child to stay a full day, modify the schedule a little bit if you can. So if the child is just a wreck after 2 hours, maybe, for at least a week, just if the family's okay with it. And again, this would really depend on the family's schedule and resources, but maybe suggesting that we start on a modified schedule. Let's see how so-and-so does staying from 9 to 10. And then if the child, starts to get better and masters that, then you can expand or increase the number of hours the child stays after that. Because I think it's defeating for the child and the family and for the teacher if we set our expectations beyond what the child is capable of and the child consistently can't meet those expectations. That really doesn't feel good. Whereas I think if you do a modified schedule and the child does well, you feel good, the child feels good, and may be ready for the next step after that. try to read books that validates children's experiences. I love The Kissing Hand. It's one of my favorite books. So that's a great book that just talks about, you know, how it can be difficult to separate from mommy or daddy or whoever the caregiver is. When Really Worried is a great book. Consider if center policy allows it, consider allowing children to bring a comfort item that reminds them of home and gives them some reassurance. I put family photograph because they do say that risk of exposure is less through paper-based items. And you may feel more comfortable with a child bringing something like that as opposed to a teddy. And then again, continue to build rapport in small doses. You know, relationship building takes time. You know, if you try to connect with a child and it doesn't work, give the child space and then try again. Don't give up. And then again, as an educator, you know, it's important to acknowledge your own feelings. Yes, we understand that this is a stressful time for parents and children, but it's also a very stressful time for directors and teachers too. And it's okay not to be okay. Young children, especially toddlers, may not understand what's happening in the world, but they can definitely sense when caregivers are upset, and they may start to match our emotions, which is why it's really good to be in tune with your own emotions so you can deal with them appropriately. Because we know children, they're sponges. And for being very young, they're pretty emotionally intelligent in terms of being able to read our facial expressions, read our emotions, and they are very sensitive to how we feel. So just like we do with children, try to acknowledge your feelings rather than pushing them away. And then after acknowledging your feelings, try a coping method, something that you can do in the moment. And you can go ahead to the next slide, Joanne. I know some centers or some directors are able to give teachers breaks, you know, when they're having a difficult time. But this may not really be possible anymore, you know, due to the small number of children and the small number of staff, you know, that may be working at one time in one center. And I know because of risk of contamination, a lot of centers aren't even having floaters anymore. So, you know, unfortunately, teachers may have to go a whole day without, you know, necessarily getting that time for themselves. So it's really important to try to think of how as teachers, you can give yourselves some space within an area where you're sort of inundated with children and noise and all those other things that might be stressful. Grounding techniques are pretty similar to mindfulness techniques. They keep us in the present moment and can keep us away from distressing thoughts about the past and the future. The focus is on your 5 senses: touch, taste, sight, sound, and smell. And then the next slide gives some examples of some. So grabbing a piece of, see, no, it's misspelled, but I meant to say rub a piece of clothing. So you might have, like, I don't know, a texture that you find soothing, and maybe keep like a little piece of cloth or a rock inside your pocket and rub that when you start to feel anxious. And a lot of these things you can do with the kids too. I think not only it's good for you because it's helping you self-regulate, but it's good modeling for the children too. So I think it's okay to tell the children, you know what, you know, I'm having some big worries right now, or I'm feeling a little bit frustrated. I'm going to take 3 deep breaths. And I think just to wrap up a little bit, flexibility and patience take time to develop. I don't know if it's necessarily an innate trait that we're born with. But I think it's something that is going to be somewhat of a lifesaver during this time. Just knowing that normal routines have changed and will continue to change. Each day will be different, depending on what the children need emotionally, depending on what you need emotionally. And be kind to yourself. As an educator, you play a very important role, but you're not superhuman, even if the kids think so. I think sometimes they think that, you guys live, sleep, and breathe in your classrooms and you never go home. But you're not superhuman, so be kind to yourself and admit when you're struggling. So these are just some online resources. And like I told Joanne before, in terms of specific visuals, or as I can set out to you all. And if you have questions or need support, I'm the ECCP consultant that covers the Southington area. I know Joanne has sent out my teleconsult flyer and my contact information. It's also on the website. So feel free to call me, email me, if you want some suggestions, some feedback, some resources. We're here to help, especially in regard to
So thank you, Julie. I'm going to share.
I really feel. Go ahead.
I'm going to share the slides on our website and send it out to everybody along with the recording.
Sure.
So there are people who are here on the phone, so you'll be able to see the slides that way. Does anybody have any questions for Julie?
I hope some of that information was helpful.
Anybody at Giggles and Grins? I took the 3804 and the 9546 number off mute for a minute.
Hear what she said.
Any questions?
No.
Okay, then I'm going to stop recording.